Hello and welcome to Gwinnett Business Radio, a very special edition. I'm Mike Salmon, and today we are joined by a couple doctors from Eastside Medical Center as we are here to raise awareness about heart health. And joining us on the program today is Dr. David Casey and Dr. Edward Claremont. Before we get into some of the questions and we talk about heart health, Dr. Casey, tell me a little bit about your background and your specialties.
I'm from Opelousas, Louisiana, small town in Louisiana, Southwest. Cajun country, and I went to school at Southern University and then went to medical school at Tulane University Medical School in New Orleans. And then from there, LSU residency for internal medicine. Then I flew to Chicago for continuation of my training in cardiology at University of Illinois in Chicago, and then interventional cardiology at the same institution. And then found my way back to the South and now to Atlanta, where I practice at Eastside Heart and Vascular.
What are some of the conditions that you work on here at Eastside?
So I take care of the heart, basically the pipes of the heart and the legs. So when people come in for heart attacks, I place stents in their hearts to open up the vessels. Also, when people have stable or coronary artery disease that is causing them chest pain when they do activities, or shortness of breath when they do activities, I also treat that. Also, when people have pain in their legs and their lower extremities when they walk, also help to open up those vessels of the legs as well.
And Dr. Claremont, a little bit about your background and the specialties that you treat here as well.
Sure. So I was born and raised in Montclair, New Jersey, a small town really close to New York City. I did my undergraduate training in biomedical engineering at Duke University. Before I was in Atlanta for a couple of years at Emory, where I started with my medical training. I did my medical school as well as my residency training there in internal medicine. Took a trip up to Philadelphia at the University of Pennsylvania, where I did my cardiology training as well as my electrophysiology training. And then my wife really wanted to come back to the Atlanta and greater Atlanta area, so we moved back.
You use some big words there. What are some of the common conditions that you would treat that we would understand?
Sure. So I think Dr. Casey kind of talked a little bit about, cardiology in general and the things that he manages. We like to break things down in terms of the plumbing of the heart as well as the electricity of the heart. And he is primarily dealing with plumbing issues, and I'm directly dealing with the electrical issues of the heart. So in addition to taking care of patients who come in with chest pain, my specialty is taking care of folks who either have too many heartbeats or not enough heartbeats. And so for patients who suffer from things like palpitations or fainting spells, a lot of times I'll take care of them and could do therapies like a pacemaker or defibrillator. And for folks who unfortunately have too many heartbeats, or an arrhythmia as they call it, things very common like atrial fibrillation, which folks may have heard of before, I also do ablation procedures to treat that as well.
Okay, so as we sit here and talk about a healthy heart, obviously you want to be able to know the signs if there's some issues going on. Dr. Casey, are there some different symptoms that a man might see when it comes to a heart condition compared to a woman?
Potentially. I mean, the most common symptoms of heart attacks or coronary disease is basically chest pain, chest pressure, usually that dull sensation, somebody sitting on your chest, which can radiate to the left shoulder, can radiate to the jaw. And that's generally the symptoms. But sometimes, whether it's male or female, noting that women oftentimes present atypically, but men can also present atypically. You can have symptoms of acid reflux, sometimes people call, or GERD, or indigestion, people say, where they, I have to burp, or I just feel this funny feeling in the center of my chest. And oftentimes that can be coronary artery disease. Sometimes it can not only present in the center of the chest, but off to the left. And sometimes people can have profuse sweating or just not feel right, an uneasy feeling. All those things, all those symptoms can be signs of coronary artery disease. That's why, especially with the prevalence and the incidence of coronary artery disease being and heart disease, period, being one of the number one killers of both men and females, we try to urge people to pay attention to their symptoms and seek medical attention as soon as they can.
Well, that's the paradox there, is you want to have it checked as soon as possible, but how do you know if it's just a small case of indigestion you said that could be one of the symptoms, or is there something wrong with your heart? How do you decide how urgent it is that you get help?
Well, that's one of the problems, or one of the things that plagues a lot of people. They don't know how to gauge the severity of their symptoms, and I just urge people, whenever they do have symptoms, just to seek medical attention as soon as they can, and don't push it off. No matter how mild if it's atypical and is out the norm, then they should have a medical professional check it out.
Yeah, even if it's your family doctor, you go there and he could say, listen, this may be more. He could send you off to the hospital.
Exactly.
Exactly right. And I'll piggyback on a lot of the good points Dr. Casey is making. I think it's important to form a good relationship with a physician that you trust, especially if that's going to be a family practitioner or a primary care physician. That way, not only are you seeking attention when you have these symptoms, but also going in for routine well checks to make sure that you're getting the appropriate screening so that we can potentially pick up on a lot of these issues before they become bigger issues. And for a lot of folks who have those atypical symptoms, sometimes that visit with your well care doctor, or with your primary care physician rather, can prompt them doing a study that can pick up on something that could potentially save your life in the future.
I would think one of the ways that you may be able to help yourself is to get your heart checked on a regular basis. Is that something, that a lot of people do? I don't hear about it too much, and maybe we should hear more about it. And B, how do you have your heart checked?
There's a number of different studies that we can perform to check on the heart specifically. But even before you get to that, I think it's important for us to look at all of the different risk factors that increase your risk of having cardiovascular disease. So, some of the silent killers that we talk about, having high blood pressure that's untreated, having high cholesterol that's untreated, having sleep apnea, living a sedentary lifestyle. All these sorts of things should certainly be addressed on a usual basis. And when you go to see your primary care physician or your family doctor on a regular basis. But if you get to a point where someone needs to have their heart specifically studied, there are a number of different ways that we can do that, whether or not that's using ultrasounds or CT scans or CAT scans, MRI scans, stress testing, or catheterizations. There's a couple of different ways that we can actually look at how well the heart is either functioning with pictures or looking to see how well it functions through testing.
So what I'm hearing, Dr. Claremont, is that heart disease in many cases can be preventable. So let's talk a little bit more, and you touched upon it, but let's make sure we stress the do's and the don'ts. We'll let one of you take the do's, do this, and we'll let the other one of you take the don'ts, don't do this. So Dr. Casey, you get to choose which one you want to take first.
Okay. So I'll take the don'ts because I see a lot of people doing the don'ts, and that's what ends them. They end up in the hospital doing a lot of the don'ts. So tobacco use. If you're smoking cigarettes, quit smoking cigarettes. I mean, that's one of the number one reasons why, or risk factors for people ending up with coronary artery disease. And I'm sure Dr. Claremont's going to go over some don'ts too, as it relates to atrial fibrillation and the kind of the electrical side. But and I'll do some of the do's too, because those are important from our respective specialties. But exercise, he touched upon it earlier. Exercise, moving. The American Heart Association, the ACC, American College of Cardiology, all have really good recommendations on how much to move. You want to move as much as possible. Any type of moving is good moving. You just want to get up, not be sedentary. It doesn't matter if it's 10 minutes a day. The goal is for 150 minutes in a week, or 30 minutes 5 days a week. But even little as 10 minutes a day can show large improvements in people's cardiovascular risk. The other thing, diet. Right? I'll stick to the don'ts. You don't want a diet with hamburgers every day, or French fries every day. You want to mix some vegetables in there and try to limit as much of that stuff as you can. Of course, people know there's much data out there on the benefits of eating vegetables, staying away from saturated fats, and all these things. People see this as ad nauseum, but the small changes that we can make, every day. Maybe you typically eat that hamburger at lunch, then you go home and eat a big meal. One of those meals, maybe eat a salad. Make small changes that can lead to large changes. You can see very, very drastic changes in your overall health, not only in cardiovascular disease. What
I'm hearing here is that my son is pulling the wool over my eyes when he says the French fries. those are potatoes. That's a vegetable. So
doesn't
Doesn't
count.
count.
Doesn't count.
Some more do's and don'ts, Dr. Claremont.
Sure.
If Dr. Casey left any out there.
Sure. Yeah. No, he hit a lot of really important points. And again, stressing the fact that forming that partnership with your healthcare practitioners is incredibly important. That way you can make sure that if you already have some of those risk factors, high blood pressure, high cholesterol, diabetes, that you can be appropriately managing those with the help of their guidance. But outside of that, eating right is paramount, and making sure that you can avoid some of these risk factors as well. And to his point, making small changes and not expecting that someone's going to be able to go on a complete vegan diet, starting tomorrow. It's making those small adjustments, cutting out those sugary soft drinks, or trying to substitute a healthier meal in place of one that might be fattier or saltier than you ordinarily would take. And then again, to his point, moving. I think, getting exercise on a regular basis is paramount as well. And to his point, again, in the same sense that you can make subtle or small changes on a day-to-day basis, I find that advising my patients to make small incremental changes in how they are exercising or moving can also help. So if you have an opportunity to take the stairs at work as opposed to taking the elevator, that's one small change that you can make. Or if you park in a large parking lot, maybe parking a little bit further away, so you have to walk a little bit further to get into the door. But, again, we would love for all of our patients to become marathon runners and start exercising and get out there and do those sorts of things, but we understand that that's not entirely realistic. But making those small changes in your life can make a huge difference in general.
Yeah, as you both have kind of referred to, something is better than nothing.
Correct.
Obviously, we know we're going to have experts when it comes to heart health when we come to Eastside Medical Center, because you two doctors perform here. Why is Eastside Medical Center the place that a lot of folks should consider? We'll give you a chance as we wrap up the program here to talk about the benefits of Eastside Medical Center and what makes you guys a leader when it comes to heart health. Dr. Claremont.
Well, first and foremost, we take pride in the staff that we have here at this facility. Incredibly joyed to work with the folks that I interact with on a day-to-day basis, and really the team effort that we put together towards getting people healthy, I think, is paramount to making sure that you have good outcomes. But the facility itself has a number of different state-of-the-art facilities in it that we can utilize to make sure that we get the best outcomes for folks. Case in point, the Electrophysiology Lab, where I do a lot of my procedures, those pacemakers, defibrillators, or ablation procedures. The equipment that we have here is top-notch. Some of the equipment that just went in past couple of years ago is the exact sort of equipment that you would hope to see in a facility that does these sorts of things. So you understand when you come here that you're not being practiced on or not getting care with equipment that was a decade, 2 decades old. So we have the latest and greatest available to us to take care of you, and world-class staff here that know what they're doing and are committed to making sure that you get out of here safely to your families.
To add on to that, even if technology changing every single day, it's something that maybe a couple years old may already be outdated. So I know Eastside stays on top of that. Dr. Casey, did it leave you any pros that you could talk about when it comes to Eastside Medical Center and why you should come here when it pertains to your heart?
Right. He made some very, very good points. I just want to stretch the team approach that we use to treat every patient, and the amount of experience that we have with all of our physicians here. Not only us young guys, that are talking on the radio, but we have guys that are in the group that have been practicing Gwinnett over 30 years. So we have when we use that wealth of knowledge and wealth of experience along with our dedication and superb equipment that we have here, we're able to produce some very good outcomes for our patients.
Let's make sure that we do raise the awareness for heart health, do the right things. You heard the do's and the don'ts. Dr. Edward Claremont and Dr. David Casey, both here with Eastside Medical Center. Thank you for joining us on the program.
Oh, our pleasure.
Thanks,
Thank you so much.
And thank you to our listeners for joining us on this very special Eastside Medical Center edition of Gwinnett Business Radio on Business RadioX.